Typhoid fever is a bacterial infection that can spread throughout the body, affecting many organs. Without prompt treatment, it can cause serious complications and can even be fatal. It's caused by a bacterium called Salmonella typhi, which is related to the bacteria that cause Salmonella food poisoning. Well, joining us to further understand this is Dr. SAMSON, SHONOWO, the Medical Director, SHONOWO Hospital. Thank you, Doctor, for joining us.
Good evening. I'm glad to be here.
All right, now talk to us. How bad is typhoid fever? I ask because it would seem that everyone who has malaria also has typhoid, and many of these people are even self-diagnosed.
Yeah, how bad is typhoid fever? Typhoid fever is very bad. In fact, it's so bad that if not treated, 1 in 3 people with the condition will die of the disease. Even if they get treated, like about 4% of people who get treated go on to become chronic carriers who can still infect other people. But the good thing about it is, if the treatment starts early, depending on which stage the person presents to the hospital, within 3 to 5 days, the symptoms will disappear. It is the most common intestinal infection known to man. Like they say, there's 11 million cases worldwide, and the kill rate is about 30%. 1 in 3 people will die if not treated. And the bad thing is, it is common to places with poor hygiene and overpopulation, places with bad sewage disposal, places without access to clean water, clean potable water, Southeast Asia, Sub-Saharan Africa, of which Nigeria is a member.
Right. You said something about chronic carriers. To some persons, this might sound quite strange. So you mean there are people who are chronic carriers of typhoid? What is the implication of this on their health or even on the health of other people around them?
Now, one thing we need to know about typhoid is it's a microorganism, like you rightly said, caused by Salmonella typhirium, or Salmonella typhi for short. It lives in the intestine and bloodstream of humans only. Animals do not carry typhoid. So the only spread is from human to human. So if one gets treated, the bacteria might still be in 4% of cases, might still be in the person's system. And that person will usually pass them out through their feces. So in places with bad sewage disposal, where the feces gets to, like people who defecate in the river, for example, or who defecate indiscriminately along drainages, if that kind of feces gets in contact with water or contaminates water, and that water finds itself back into the circulation, either through poor hygiene practice or poor sanitation practice, that can still infect other people if those ones drink water that has been contaminated by the feces of an infected person. Or it's very common in people who eat raw fruits and vegetables. If you use contaminated water to wash your vegetables or to wash your fruits or to cook your food, you understand? That's how people who have been infected or have been treated can reinfect. The chronic carrier, that's how they reinfect. Or if the person goes to poo and doesn't clean up properly, and it comes to shake you, and you use that hand to eat without washing, you understand, you get the drill now.
That's quite scary. I can't imagine that. Anyway, let's talk about the symptoms.
I would say just 2 symptoms are really, let me not say peculiar, are really noticeable, to typhoid. That is the high-grade fever, the high-grade continuous fever, and the rash. They are really specific to typhoid. Now, what I mean by high-grade continuous fever is the fever doesn't go down. It keeps going up. Normal body temperature is 36.5 degrees to 37.2. So when someone has typhoid fever, it starts like 37.5. The next time you check, 37.6, 37.7, 37.8. It just keeps going up. They call it step ladder fever. Just keeps going up like you're climbing a ladder. You understand? Unlike malaria that has intermittent fever. In the morning, you might be febrile, you'll be shivering and everything, and at night, you'll be better. Or you might be better in the morning and worse in the evening. The fever comes and goes in malaria, whereas in typhoid, it just keeps going higher and higher and higher. Then there's the spots, that there's a kind of rash that appears in typhoid. It is rose color, so they call it rose spots. You understand? Not everyone, like human beings differ, so the clinical presentation of everyone is different. Now, typhoid comes in 4 stages. There's the first stage, in which the person just has maybe like a little bit of cough and headache. Then the second stage, that's when the high-grade continuous fever comes in. Then the person starts to have what we call fever nightmares or fever dreams, in which the person will have dreams like walls caving in on him or her, or someone trying to choke him or her by the neck, things that are by the third week, their intestines tends to perforate, the organism perforates the intestine and they bleed internally. But generally, I would say the symptoms are high-grade fever, abdominal pain, abdominal discomfort, constipation or diarrhea, vomiting, muscle weakness, and things like that. Just symptoms of the intestine of the digestive system. Now, if the case is, like I said, I forgot to say that the symptoms can be based on the disease itself or its complication. The ones I mentioned earlier, the fever, the spots, the rash, the abdominal pain, the bloating, constipation, diarrhea, those ones are due to the disease itself. Now, the thing about the disease, it can go from the intestine and spread into the bloodstream to other tissues and organs. And when that happens, of course, it will give off other symptoms based, it gets complicated. So that means it will give symptoms of its complications. It's logical, Abby. So if it has spread to the lungs, the person will have symptoms of pneumonia, cough, fever as well, and all those things. If it spreads to the liver, if it spreads to the kidneys, it can give kidney failure. If it spreads to the brain, it gives something called encephalitis. Anything encephal means brain. Litis means disease. So brain disease it can cause meningitis if it spreads to the spinal cord. It can cause osteomyelitis if it spreads to the bones. The person won't be able to sit or stand. It can perforate the intestine and the person will bleed internally, so much so that the person will require surgery. In some cases, if it spreads to the brain, it can present as psychosis. The person will act like a severely ill mental patient, scattering everywhere. They call it typhoid psychosis. And at the end, most typhoid patients, if untreated, usually don't last more than a month. That's 4 weeks. And at the end, it comes with death if untreated.
This is quite scary. I do not know if a lot of persons know these things about typhoid. You were saying?
Yeah, the major cause, the reason why you mentioned one thing about people who have malaria having typhoid earlier. I think that was part of your first question.
Yes, that was part of the first question.
You said something about people having, yeah. So the thing about that is the major culprit here, I wouldn't say culprit per se, but the major reason there is the test called Widal. Some people say Widal, depending on how you pronounce the I. I say Widal test, where they say high titer, significant titer, 1/60, 1 over this, 1 over that. Now, the thing, what we don't know, the only advantage that I can say Widal test, the only benefit, let me not say the only benefit it has is that it is cheap. Besides that, no other benefit. Number two, in practicality, let me use that word, Widal test is not being done the way it's supposed to be done anywhere in the world. Now, the thing about Widal test is that you take a sample today, you test it, it comes out within a few minutes. You are supposed to take another sample in 7 to 10 days, then compare before you can now bring out a definitive result. But most people worldwide in practical just use the first sample, which comes out in a few minutes, and say that is your result. Now, the downside of Widal is that it cannot distinguish between someone who has had a previous infection, someone who is having a current infection, and someone who has been vaccinated. Typhoid, the Widal test cannot differentiate between those three. Also, there's something we call false positive result. That means in a person that is negative, the test will tell you the person is positive. For example, guess what? In people with acute malaria, Widal test will always show positive results in people with acute ongoing malaria, especially in children. So that is why whenever you go for a malaria and typhoid test, in quotes, the typhoid 9 times out of 10 always show significant titer. But how can you differentiate? The fever alone should be able to tell you what exactly you're dealing with. If you feel okay in the morning and you have fever at night, or if you feel okay at night and you have fever in the morning, then I can beat my chest anywhere. It is malaria until proven otherwise. And trust me, people who say they have typhoid, they don't want to have typhoid, because with the way the fever comes, by day 3 or day 4, you have no choice. You would have landed in the hospital. There is no two ways, because the fever will keep going up. The discomfort will be too much, and you would have to be the one to request that, please, maybe now they carry me go. You understand what I'm saying? Also, okay, you want to say something, right?
No, go ahead. Go ahead. We're good.
Also, the organism that causes typhoid, Salmonella typhimurium or Salmonella typhi for short, is not the only member of that Salmonella species. There's also a disease, a similar disease called paratyphoid that is caused by Salmonella paratyphi ABC or Salmonella enterica. Now, the wider test cannot differentiate between Salmonella typhi, which causes typhoid, and the other members of the family. So even if it shows a high titer, it can as well be the other members of the family. But the thing is, the wider test cannot differentiate. Now, the best way to test for typhoid is either in the blood culture, stool culture, or urine culture. But the best, most, what will I say, most sensitive one is the bone marrow culture. You understand? But the thing is, you only use that bone marrow culture in people who have used antibiotics but have not gotten well, who have been treated for typhoid but are not getting better. You can then go further to take a bone marrow sample for that is the only indication for the bone. But otherwise, the blood culture, the stool culture, or the urine culture, depending on what stage the typhoid. Some people say in the first week the blood culture is better. Then in the second week of the patient, patient presents at different times, Then in the second week if the person presents in the second week, it's better to go for a urine sample. Well, no, a stool sample, sorry. While if the person presents in the third week, it is better to go for the urine sample. So it's blood, stool, urine. I cramped that when I was in medical